Coming to the standard precaution as per se, infection prevention practices used with all patients regardless of suspected or confirmed diagnosis. See, this is a very important point. I would like to stress this point to the learners that standard precautions are mandatory, irrespective whether your patient got screened for viral diseases or bacterial diseases or not. The moment the patient comes into the hospital, you have to follow some standard precautions. It is not like after the report comes, if the patient is HIV positive, you are wearing gloves and going near the patient, or if the patient is tuberculosis, wearing N95 mask and going near patient. Irrespective of the diagnosis, irrespective whether any test has been performed on the patient or not, we have to follow standard precautions. It is mandatory and it has to be followed. Based on the principle that all blood, body fluids, non-intact skin and mucous membrane contain transmissible infectious agents. That is what I am trying to tell here, is that just think that the blood and the body fluid of the patient, even the non-intact skin and the mucous membranes are infectious. So, we have to take a standard precautions irrespective whether the test has been done or not. Previously, standard precautions were termed as universal precautions, which in the recent CDC guidelines it has been replaced as standard precautions. It is nothing but implementation of standard precautions constitute the primary strategy for prevention of high healthcare associated transmission of infectious agents among patients and healthcare personnel. That is what I was telling just now. The transmission of infection could be between the patient to patient, and it could be between the patient to the healthcare provider, and it could be between patient to the attendants and the visitors who are coming and attending the patient. So, the route of transmission can occur through any way, or sometimes if the healthcare provider is immunocompromised or weak, they get infected very fast with the infections they are taking care of. So, it is the implementation of standard precautions constitute the primary strategy for prevention of healthcare associated transmission of infectious agents among the patients and healthcare workers. Assume all are infected. That is what we have discussed just now in the previous slide. Like when we do not know the status of the patient coming to the ER with a road traffic accident and bleeding from the head, wear the personal protective equipment and go near the patient. Assume that all the patients who are coming to your ER or coming to the healthcare industry are infected, because most of the time it happens during the subsequent investigations we come to know that the patient is positive for HIV or hepatitis B or hepatitis C. So, that time we should not regret for not wearing the personal protective equipment and directly touching the patient. That is where it is very important for all the learners. You should understand that if you want to work in a healthcare industry as an infection preventionist or an infection control officer, make sure that your employees of the hospital follows the standard precautions at all time. This is what the very important slide. I think this one slide will complete the complete module of standard precautions. I was just telling, when I go to the slide of standard precautions, I am going to explain you about the details what it includes all. The first important and the foremost thing it has is hand washing. Remember, hand washing is very important. Hand washing, there are a lot of misconceptions between the healthcare workers that when to have hand washing with soap and water and when to use hand rubs, alcohol rubs. See, one thing is very clear, whenever your hand gets visibly soiled with blood and body fluids, you have to wash your hands with soap and water. Whenever you are taking care of a patient with Clostridium difficile infection, you have to wash your hands with soap and water. Remember these two indications which are commonest. I am telling in your mind, okay, when are you going to use hand wash? One, when your hands are getting visibly soiled with blood and body fluids. Another thing, scenario where you are taking care of a patient who is infected with Clostridium difficile, because most of the disinfectants are not effective against the spores of Clostridium difficile. Second part, if you see in the standard precaution comes is the use of gloves. Before I go into the gloves, there are different ways of washing your hands and also using the hand rubs. See, the first thing is doing palm to palm. Whenever you are washing your hands or using hand rubs, make sure that first step you do is rubbing hand to hand, then the right dorsum, then the left dorsum, interlacing of fingers, interlocking of fingers, and the tip of the fingers, rotation of thumb. These are the basic steps you need to follow. That is the basic steps given by the guidelines, WHO guidelines. See, the purpose of following the steps is that so that each and every part of their hand is covered. Palm to palm, right dorsum over the left, left dorsum over the right, interlacing of fingers, interlocking of fingers, tip of the fingers, rubbing the tip of the fingers, rotation of the thumb. These are the important basic steps we need to follow whenever we use hand washing, either through a soap and water or by using alcohol based chlorhexidine rubs. Coming to the next part of the standard precautions, which is very important, about the wearing of gloves. See, whenever you are coming in contact with a patient where there are chances you get contact with the blood and body fluids or the pus of the patient or sometimes vomitus and the urine and the stool of the patient, please wear gloves. There are many, again the indications when to wear sterile gloves, when to wear non-sterile gloves and when to wear the normal one which is used for the housekeeping purpose, utility gloves, that is called as. So, the sterile gloves are always wear whenever you are coming in contact with the patient's sterile surfaces or you are touching the patient equipments or devices which are sterile. Always wear sterile gloves, and for other purposes, for other like taking care of the Ryle's tube or a Foley's catheter, then you can use non-sterile gloves. The utility gloves can be taken care, will be used by an housekeeping staff. Coming to the third part about the mask. Whenever you are going near the patient who is having a respiratory illness, please wear mask. When I talk you about the details about the airborne and the transmission of the droplet transmission, I will tell you what type of mask has to be wear when taking care of droplet infections and what type of mask has to be wear when taking care of airborne infections. And after this, once the hand wash is over and your gloves you have weighed and then mask you have kept, then comes the gowns. Whenever you have dealing with the patient where there is chances of blood splash or vomitus or a surgeries where there are chances of again sudden splash of body fluids, you have to wear gowns. This is the fourth important part of the standard precaution. Now comes the fifth one where you minimize the safe work practices. Suppose if you are having a sharps, so immediately you are going to discard it. Many times we see the commonest cause of needle stick injuries, a major occupational hazard in healthcare industry, is the recapping of needles. After telling many times to the nursing professionals and even sometimes to the doctors and anesthetists, due to some reasons they do recapping, and whenever you recap, the chances of injuries are very high. In case if you want to recap the needle, you have to follow scoop method where you are going to put the cap and then you have to recap the needle into the cap through one hand, not through both the hands. And always make sure that whenever you are using sharps in the hospital, you should not carry it for a long distance to discard. Make sure the discarding point of the sharps is very near to where you are using to the patient. Another important cause of sharp injuries in the hospital is carrying the sharps in the hands. Whenever they carry the sharps in the hand, there are fair chances that your colleagues or some of the healthcare workers who are coming from the opposite side, they may get accidental injuries. That is another important aspect where you are going to discard the sharps immediately as when required. Whenever you are discarding the biomedical waste, you have to follow BMW 2016 guidelines, the new guidelines which has come, where it has enumerated very in detail about the types of waste which is going to be in the red bin and what type of waste you are going to put in yellow and which you are going to keep in white and which you are going to keep in the blue cardboard box one which is added in new BMW guidelines, and there is no role of hypochlorite now in a new guidelines. Coming to the fifth aspect about discarding your linens, laundry and linens. Whenever you see, as in a hospital, you need to form a policy, infection control policy, where you have to document in your infection control manual what all the things, the infectious and the non-infectious waste, how are you going to handle in your hospital. Many times we saw the infected linen and laundry is being mixed with a non-infectious laundry and linen, and that thereby transmitting the infection to other areas of the hospital. So, in a hospital you need to define a policy, how are you going to treat your infectious waste and also how are you going to treat your linens which get soiled with blood and body fluids. And the last one, which is again very important, is about the environmental cleaning. Environmental cleaning plays a very important role. You believe me, if you do not have a proper environmental cleaning practices in the hospital, we will end up in having the epidemics in the hospital. That is the reason why selection of a right disinfectant in a right concentration in a proper contact time with proper monitoring is important for the good environmental practices in the hospital. So, in short, the standard precautions talk about the hand washing, wearing of personal protective equipments. Whenever I tell PPE, it means the gloves, the mask, gown and discarding of the sharps. So, this is what the personal protective equipments are, and also in the standard precaution it also includes laundry and linen management and environmental cleaning.